Community Analysis of South Tampa, narrated by Paulina McIntosh, Nicole Moulton, and Markeisha Ruth. South Tampa's areas and zip codes that are included in our presentation are highlighted and listed below. Tampa Bay area was discovered by Spanish explorer Ponce de Leon in 1513. Tampa Bay really started to develop after it became a part of the United States in 1845. In 1884, a railroad addition to the Hillsborough River was constructed for the shipping and mining of phosphates, which stimulated growth in the community. The Port of Tampa is now the 7th largest in the nation for the trade of phosphates and shrimp. It also manages cruises, departures, and arrivals. South Tampa's downtown city life is largely due to one man, Vincent Martinez Ybor, who founded a cigar factory in 1886. Some of the cigar workers were encouraged to fight against Spain in the late 1800s in the Spanish-American War. During the war, the Port of Tampa was the primary location for sending active military troops back and forth between Cuba. MacDill Air Force Base is now where the Central Command Center and Special Operations Headquarters exist. St. Petersburg-Tampa Commercial Airport Line was constructed in 1914. The automobile was later added in 1923 to 1926, slowing the commercial airboat line, but increasing settlement around Tampa. Tampa's downtown business district encompasses banks and other corporations that can be found in high-rises along the Bay Area, sharing the bay with Tampa's Convention Center and a very popular boardwalk named Riverwalk. There are kid-friendly museums downtown and theaters for the art-adoring crowds that generates tourism and wealth for all of the community.
Tampa housing options vary widely in the types of structures available to its residents, such as high-rise condominiums, apartments, to large prestigious homes in South Tampa to small single-family homes. Unfortunately, Tampa has land growth limitations due to the surrounding Hillsborough River, which ultimately forces builders to build vertically, therefore causing a significant increase in the market price for these residents. When comparing neighboring towns such as Riverview, housing options are similar except there are no high-rise residential houses offering. Since Riverview has land available for growth and development, many residents are willing to commute from surrounding towns in order to get more for their money when it comes to the housing market. Tampa has a multitude of travel options for the residents as well as tourists. Transportation options consist of land, air, and sea. Land access is primarily attained by the main interstates options such as I-4, I-275, and the toll road Crosstown Expressway. Transportation for residents include mass transit, HART buses, taxis, and private driver companies like Uber and Lyft. Downtown offers unique transportation such as street trolleys, streetcars, and free electric gym vehicles that run 7 days a week. Air transportation provided by South Tampa's Peter Knight Airport and the nearby Tampa International Airport that offers direct flights to more than 60 domestic destinations and 10 international markets. Sea transportation is primarily based out of the Port of Tampa. There is a wide range of diversity among the uses of the port, from repairing large cargo ships to the largely popular cruise ships that set sail out of Tampa to many beautiful Caribbean ports. When comparing transportation to other communities, the ability to have air and sea travel sets Tampa apart from many other communities. Tampa provides many opportunities for the residents. However, most of these options seem to benefit the middle to upper socioeconomic class. Housing for the lower socioeconomic class can be a bit more challenging. According to Tampa's housing, there are a staggering 19,295 homes that are vacant. Based on the amount of almost 2,000 people needing homeless shelters and safe havens each year, it seems Tampa could be more resourceful in accommodating the needs of the low-income or homeless population with the amount of available vacant homes. Affordability is extremely important. With the limited land downtown, builders are required to build vertically. Along with this comes steep prices which are not affordable to most low to middle class residents, which is highly counterintuitive because most of these residents rely on public transportation and assistance, which are mainly found within the city limits. The 2010 census shows a 10.3 increase in population. This increase puts a strain on growth and development, creating a much more dense population. Tampa's density is a staggering 1,862 persons per 1 square mile, a stark contrast to Florida's average of 321 persons per square mile. Tampa's below poverty level is 4% higher than the state's average. With the density's population being nearly 6 times more than the state's average, it is imperative Tampa has an adequate housing for these residents. The enormous expense of building vertically comes with steep prices for these residential properties, ultimately continue to devastate the low to middle class residents even further as they cannot afford these high-rise expenses. According to the CDC, sexually transmitted diseases continue to plague our country with many concerns. In comparing Florida to the United States, you will see Florida ranks second highest in chlamydia cases for men and women ages 15 to 24. Chlamydia is the most frequently reported STD in Tampa. Data has proven higher rates for reported STDs among racial and ethnic minority groups. There seems to be a direct correlation with fundamental health determinants such as poverty, unemployment, income, inequality, and low educational attainment. Tampa's dense population has a direct correlation to poverty and health disparities. Access to free or affordable STD prevention and treatment services is vital to reducing the STD disparities in Tampa as well as the United States.
Health-related resources. There are many health-related resources available in South Tampa, including 3 hospitals: Memorial Hospital, Kindred Hospital, and Tampa General Hospital. They provide a wide variety of healthcare services accessible by car and public transportation, and they accept most types of insurance. There are also several home care and assisted living facilities such as Brookdale Bayshore and ResCare Home Care, which provide many services to seniors to assist them with activities of daily living. They are accessible, provide 24-hour care, and most insurances are accepted. Several walk-in clinics can be found in South Tampa as well, such as Tampa Family Health, Suncoast Community Health Center, and the Florida Department of Health. These facilities are easily accessible, provide a wide range of services such as primary care, mental health care, dental care, pharmacy, and OB and pediatric care. They provide low-cost treatment based on income, and they also accept Medicaid, Medicare, and most insurance plans. Healthy People 2020 objectives. One is cancer. Reduce the overall cancer death rate. Cancer is the leading cause of death in Tampa, so providing more education on preventative methods is needed, such as healthy diet, exercise, and regular doctor visits and screenings, and avoidance of sun. 2, heart disease and stroke. Increase the overall cardiovascular health in the population. Heart disease and stroke are a part of the top 10 causes of disease in Tampa. With obesity and hypertension being prevalent, much education and teaching needs to be done on diet, exercise, and self-monitoring of blood pressures. 3, older adults. Reduce the proportion of older adults who have moderate to severe functional limitations. A large percentage of Tampa's population consists of older adults who have chronic health conditions. There needs to be more avenues for older adults to increase physical activities within the community and education on self-management of condition. Tampa provides a variety of environmental resources for entertainment, exercise, and leisure, such as parks, walking trails, museums, and an aquarium. There are also an adequate amount of community centers that provide various activities and entertainment to the community as well. Tampa also has a police department and several fire stations that provide emergency assistance to the community in case of fire, accidents, crimes, and medical emergencies. Both of these departments also provide community outreach programs and education on fire prevention, chemical spills, and other medical emergencies. The police department response times average 10 to 15 minutes, which is somewhat inadequate and could use some decreasing by expanding their division. Tampa also has a sewage company that adequately keeps the communities free of sewage buildup, a water treatment center that keeps the water free of contaminants, and waste management facilities that allow for disposal of waste and collection of waste from homes 2 days a week in order to keep the communities clean. There is also a vector control program to control mosquitoes and animal control for wildlife. Environmental issues. Some environmental issues that exist within the South Tampa community are too many homes and buildings too close together, causing congestion and overcrowding. Another issue is the abundance of fast food restaurants and not enough healthy eating establishments. A third is too many homeless living on the streets. We need more shelters, affordable housing, and employment.
The mayor of Tampa is Bob Buckhorn. Tampa does an excellent job with involving the residents in the plan for the city. They allow public meetings for the residents of Tampa to attend. They also publish their fiscal budget for the public as well to see. There are many ways the residents can access the agenda meetings of the City Council. They can go to tampagov.net, select public meetings. They can view videos of previous meetings. They can determine the date and time of the meetings they may wish to attend, or they can simply download the mobile-friendly app and stay up to date with the latest meetings. The availability of these meetings is a plus for the residents, allowing them to be an active participant in the community. As events are unfolding in Tallahassee and in Washington, D.C., the Tampa Chamber is watching these issues that are important to the Tampa community and its businesses. Listed here are the agenda issues that the Chamber is continuing to follow.
Prioritization of community needs, arranged in order of importance of needing addressed in Tampa. Number 1, obesity. 33.9% of Tampa's population is overweight. Being overweight can cause many other health issues. Number 2 is cancer. Cancer is the number 1 cause of death in Tampa. Number 3, heart disease. Heart disease is the number 2 leading cause of death in Tampa. Number 4, poverty. 21.8% of Tampa residents live below the poverty level and can't afford the necessities of life. Number 5, crime. Tampa has a very high crime rate, average of 287.5 per 1,000, which is higher than the U.S. average of 286.7. Sexually transmitted diseases is number 6. Chlamydia, gonorrhea, and syphilis are the top 3 of the top 10 communicable diseases in Tampa.
In comparing the local and global community health issue, obesity ranges number 1 in Tampa and Argentina. 33.9% of Tampa's residents are overweight versus Argentina's 50.5% being overweight or obese. South Tampa has attacked the issue by providing resources and funds geared toward the following programs targeting healthy weight loss: the YMCA, encouraging families to exercise together; Kids Bite Back, which educates students about big fat industries and couch potato companies that promote excessive consumption and sedentary lifestyles. Students must spread the word to others and improve and promote nutrition and increased physical activity. The Safe Routes to School program provides a safer, easier, and more fun option for children to walk or bicycle to school. In Argentina, ongoing national public debates for drug efficacy and bariatric dignity treatments about obesity makes the country aware of the obesity issue in the population. Ley de Obesidad, approved in September of 2008, limits the advertising of foods that contain excessive fats. It assures nutrition information is on the labels and ensures the rights to healthful foods in schools. As you can see, both local and global strategies are geared toward primary prevention of obesity.
Where can we try?
A community health nurse may intervene and attack the obesity issue by teaching and advocating for healthier alternatives in schools. Primary prevention is key, so the nurse should start with the younger community. These are very simple interventions listed that may be done on a local or global scale depending on the resources in our community and other countries. Implement snack times in schools with only healthy snacks and teach fun exercises that can be done without equipment. Thank you for listening to our presentation. Here are a list of our references.